Welcome back to Health and Home Report. I'm Laura DeAngelis. Vasculitis is a family of rare diseases characterized by inflammation of the blood vessels. These diseases can affect people of all ages, and while some forms of vasculitis improve on their own, most require treatment to prevent organ tissue damage. Well, right now we are pleased to welcome Dr. Bob Lebovics to this month's show. He is an otolaryngologist and one of the esteemed physicians who works with the Vasculitis Foundation to help patients and their families. Doctor, welcome to Health and Home Report. It's a pleasure to have you with us.
Thank you, and it's an honor for me.
So let's again start right off with what exactly is vasculitis?
Vasculitis is a group of diseases that's mediated by the body's immune system. It attacks blood vessels, be them small, be them large, arteries, veins, even capillaries.
And what kinds of symptoms might someone experience if he or she is suffering from one of these rare diseases?
There are a group of symptoms that typically affect the patients with the vasculitides. Unfortunately, they're very common symptoms. Cold symptoms, sinus symptoms, shortness of breath, fatigue, arthritis. And the most common diseases happen most commonly, so often it's difficult for primary care physicians to think in those terms.
Well, like so many diseases, I know that early detection is key. You just mentioned how that could be a challenge, but what kind of treatment is a patient facing once they are diagnosed?
Well, the treatments come in basically two classes, what I call medical and surgical. The medical treatments deal with suppressing the body's immune system with various drugs, prednisone or other more potent immunosuppressives. On the other side, there's often surgical treatments, either for diagnostic purposes or therapeutic purposes. For example, in my group of vasculitis patients, I do a lot of surgery on their windpipe or their trachea.
Well, now let's talk about the work of the Vasculitis Foundation. Please tell us about the mission of this organization.
This is a great organization that's a nonprofit. It was founded by patients for patients. It has several focuses, specifically patient support to help people who are newly diagnosed with these rare diseases. Additionally, it promotes awareness both in the lay community and, more importantly, in the medical community, hopefully to encourage early diagnosis. And of late, they've now actually ratcheted up their mission, and they're funding really world-class biomedical research here and even funded grants in Europe.
Well, I know that the foundation recently hosted a symposium, and there's another one coming up this summer. So how do these events factor into the foundation's work and the fight against vasculitis?
Well, these symposia, which are sponsored by the Vasculitis Foundation, give patients with these rare diseases a chance to meet professionals where they can ask questions and they learn. It also gives them a chance to meet other patients with the same diseases and who are going through a lot of the same unique problems that they're encountering. The patients, in a sense, find out they're not alone. There is redemption, there is medical help, there's a camaraderie of other patients who are suffering from these diseases, and ultimately it's to promote awareness in the lay community and additionally in the medical community. Early diagnosis will lead to better outcomes.
Absolutely. And speaking of looking for more information, we've gotten a good start here, but where can people find some more info if they need it?
Besides their professional with experience in vasculitis, the Vasculitis Foundation is an excellent resource. They have an 800 number. They're in Kansas City, Missouri, and their website is vasculitisfoundation.org. I would tell both patients and medical professionals to avail themselves of their resources.
All right. Well, Dr. Lebovics, very great to have you here today. Thank you for taking some time out of your schedule, and good luck with all of your efforts.
You're welcome, and thank you too.
For more information, visit hhrtv.com/vasculitis.